Hello and welcome to G Fun Facts Online, where we dive deep into the science behind our daily lives. Today we're asking a question that might sound strange at first. Could the key to understanding and even treating depression be found not just in the brain, but inside your mouth? It sounds like science fiction, but a fascinating field called neuroimmunology is revealing an intricate and powerful connection between the bacteria living on your teeth and gums and your mental well-being. So let's talk about the surprising link between your oral health and your mind. First, let's zoom in on your mouth. It's not just a collection of teeth and a tongue. It's a bustling, microscopic metropolis. This community, known as the oral microbiome, is home to between 500 billion and 1 trillion bacteria, making it the second largest microbial ecosystem in your body, right after your gut. When this community is in a state of balance or symbiosis, it's a huge asset. These microbes help with digestion and protect you from invading pathogens. But what happens when that balance is thrown off? This state, called dysbiosis, can be caused by things like poor dental hygiene, smoking, or a high-sugar diet. And research is now showing that dysbiosis, specifically a less diverse oral microbiome, is strongly associated with a higher risk of depression. So how does a problem in your mouth travel all the way to your brain? The primary pathway appears to be inflammation. When your oral microbiome is out of balance, it can lead to chronic gum diseases, like periodontitis, which affects nearly half the world's population. This infection can damage the protective barrier in your mouth, allowing harmful bacteria and their toxic byproducts to leak into your bloodstream. One of these toxins is called lipopolysaccharide, or LPS. Once in the blood, these invaders trigger a full-body alarm, kicking your immune system into high gear and creating a state of chronic, low-grade inflammation. This type of inflammation is already a known risk factor for heart disease and diabetes, and now it's being heavily implicated in depression. The inflammatory signals, called cytokines, can cross the heavily guarded blood-brain barrier, leading to what scientists call neuroinflammation, inflammation of the brain itself. Scientists have even identified some of the specific bacterial culprits. The most studied is a pathogen called Torus porphyromonas gingivalis, a major player in severe gum disease. In lab studies, mice colonized with this bacterium started showing depression-like behaviors. Nice P. gingivalis and its toxins are known to trigger the release of those pro-inflammatory signals that lead to neuroinflammation. Other bacteria, like Tor prevotella intermedia and Asterix fusobacterium nucleatum, have also been found in higher levels in individuals with depression. It seems specific microbes have a direct line to influencing our mood. But the story gets even more complex. It's not just a direct highway from the mouth to the brain. Think of it as a three-way conversation between your mouth, your gut, and your brain. We regularly swallow our oral bacteria, which then travel to the gut. If harmful oral bacteria make it there in large numbers, they can disrupt the gut microbiome, which has its own well-established connection to mental health through the gut-brain axis. This disruption can lead to a leaky gut, allowing even more toxins into the bloodstream, amplifying that systemic inflammation we talked about. This interconnected system is now being called the oral gut-brain axis. Imbalances anywhere along this chain can have cascading effects, even influencing the production of key neurotransmitters like serotonin, which is crucial for mood regulation. Now you might be thinking, isn't the brain protected? Yes, it has a formidable defense called the blood-brain barrier. Its job is to keep harmful substances out. However, the chronic, body-wide inflammation started by those oral bacteria can weaken this barrier, making it more permeable. Once the gates are open, the oral pathogens and their inflammatory byproducts can march right into the brain. There, they activate the brain's own immune cells, called microglia, leading to a state of chronic neuroinflammation that disrupts normal brain function. Some bacteria are even more cunning, releasing tiny packages called outer membrane vesicles that can ferry their harmful cargo across the barrier. Some may even use nerve highways, like the trigeminal nerve, as a secret backdoor to migrate directly into the brain. And the damage isn't just about inflammation. Once inside, these pathogens can mess with our brain chemistry. For example, SumpCP, gingivalis, has been shown to decrease levels of a vital protein called brain-derived neurotrophic factor, or BDNF. BDNF is like a fertilizer for our brain cells. It's crucial for their growth, survival, and ability to form new connections. Consistently low levels of BDNF are one of the most reliable biological markers for depression. It's also important to recognize that this relationship can be a two-way street. While poor oral health can contribute to depression, depression itself can make it harder to maintain good oral hygiene. Someone struggling with depression might lack the motivation to brush and floss, might eat a less healthy diet, or might smoke more, all of which create a perfect environment for oral dysbiosis, feeding into a vicious cycle. So, what does this all mean for the future? This research opens up incredible new possibilities. The makeup of our oral microbiome could one day become a biomarker, helping doctors identify who is at risk for depression. More excitingly, it points to new treatment strategies. Interventions as simple as improving oral health, regular brushing, flossing, and dental checkups could become a frontline approach to preventing and managing depression. Future treatments might also include targeted oral probiotics or prebiotics to restore a healthy balance to the mouth's ecosystem. The science is clear. The health of our mouth is deeply connected to the health of our mind. The bacteria in our oral cavity aren't just silent residents. They're active participants in a constant dialogue with our immune system and our brain. By taking better care of our oral health, we may unlock a powerful new tool in the global fight for better mental well-being. Thanks for listening to Fun Facts Online.